Today, we are going to talk about stroke recurrence and antiplatelets in posterior versus anterior circulation, minor stroke, or transient ischemic attack. It is unclear whether infarct location affects stroke recurrence after index ischemic stroke. The study aimed to compare the risk of stroke recurrence and the responses to dual antiplatelet with ticagrelor-aspirin versus clopidogrel-aspirin between patients with posterior circulation infarct, that is PCI, and those with anterior circulation infarct, that is ACI, after minor stroke or transient ischemic attack. Coming to the methods of the study, the data was obtained from the double-blind Chance 2 trial, which was conducted across 202 centers from September 2019 to March 2021. The patients with positive diffusion-weighted imaging were included and classified into PCI and ACI groups according to the hyperintense lesions on diffusion-weighted imaging. The primary efficacy and safety outcomes were a new stroke and severe or moderate bleeding within 90 days, respectively. Coming to the results of the study, a total of 4,168 patients were included in this sub-study, with 1,427 PCI patients and 2,741 ACI patients. During the 90-day follow-up, the risk of stroke recurrence in patients with PCI was similar to that of ACI. In comparison with clopidogrel-aspirin, ticagrelor-aspirin significantly reduced the risk of stroke recurrence in both the PCI and ACI groups. There was no treatment by infarct location interaction. The risk of severe or moderate bleeding was similar between PCI and ACI patients. To conclude, the study demonstrated that stroke recurrence was similar between PCI and ACI in patients with minor stroke or transient ischemic attack. Additionally, ticagrelor-aspirin was superior to clopidogrel-aspirin in reducing the risk of stroke within 90 days in both PCI and ACI patients.